I'm Kathy Riedford. I'm a psychiatric mental health nurse practitioner here at University of Southern Indiana. I practice in the field. I'm also a full-time professor, and so I have a doctorate in psychiatric nursing. I want to have a conversation with you today, and I think that conversation is important. We want to talk about depression, and that's a timely thing to talk about. It's a conversation that many of us might have, but it's a conversation that we don't want to have about ourselves, and that's why we need to talk about it. Yesterday, Robin Williams committed suicide, and we saw in the news media that it was by asphyxiation. Some of us weren't aware of what that might mean, and today, of course, it came out that he died by hanging. The tragedy in this is that it was a life that was one that touched all of us, and the suicide was something that maybe didn't need to happen. Suicide affects all of us in our interconnections with one another, and depression is highlighted by the Center for Disease Control as the most paramount thing that leads to suicides, and so that's why it's important to think about it and consider it. Robin Williams touched all of our lives. He was in many good starring roles that touched all of our lives in some way. You would recognize Mrs. Doubtfire, Good Will Hunting, Good Morning Vietnam, Jumanji, and Dead Poet Society was a significant drama that I recall. Carpe Diem, seize the day. That's something that carried with me through many years. And on the good days, I could seize it, and on the bad days, I could grab for it and hope that it was not too far in the future.
Gather ye rosebuds while ye may. The Latin term for that sentiment is carpe diem. Now, who knows what that means?
Carpe diem, that's seize the day.
President Obama summed it up well when he spoke of Robin Williams' life, that he was an airman, a doctor, a genie, a nanny, a president, a professor, a bangarang, Peter Pan, and everything in between. But he was one of a kind. He arrived in our lives as an alien, and he ended up touching every element of the human spirit. He made us laugh, and he made us cry. He gave his immeasurable talent freely and generously to those who needed it most, from our troops stationed abroad to the marginalized on our own streets in the United States. So, yesterday we could watch him in movies and laugh, and today we would watch him and cry. The strongest risk factor, as I said, for suicide is depression. In 2010, the World Health Organization listed depression as the #1 disability in the world. Again, that affords a conversation. For young people ages 15 to 24, it's the third leading cause of death. When we think of depression, it's kind of a global idea that we have, but there are certain things that are important to look for when we're looking not only at others, but within ourselves. Some of the things that would be highlights to pay attention to are sadness that lasts a good part of the day, lack of interest in things that we used to have, feelings of guilt or feelings of worthlessness, decreased amount of energy when we used to be motivated maybe to jump out of bed and get things done. Gradually over time, that becomes less and less, so we notice we don't have much energy anymore for anything. Lack of concentration, a hard time focusing on things at hand. Symptoms of extreme agitation, like you want to jump out of your skin, and then also feelings of not being heaviness, like you can't do anything. Impact on sleep, where you sleep way too much or way too little. Impact on appetite, where you gain weight or lose weight. It can go either direction. And the last one is a feeling of not wanting to be here anymore. It's called suicidality, but it's not just thinking about killing yourself. it's not just attempting suicide, it's also feelings of, I want to disappear, I just don't want to go on, I can't do this anymore, I cannot put one foot in front of the other. Those are all significant signs, and when they're grouped together and you're looking at 2 or 3 or 4 or 5 of those 9, that's a time to look out for help, to at least have a conversation with a friend or someone who you can reach out to that you trust that could help. I think probably one of the biggest things in depression leading to suicide is crawling in that hole where it feels so comfortable because you don't want to reach out and staying there, and then it becomes devastation, and it can lead to terrible effects like the suicide we have in the media at the current time. So what are resources? Talk to someone. Talk to someone. There are resources here on campus. The Counseling Center has a number of things listed on their website that are helpful. Their number is 812-464-1867. There's a National Suicide Prevention Lifeline that is, and the OR Center would only be during working hours for the university. So beyond that, there's a National Suicide Prevention Lifeline. That's 1-800-273-TALK. There is also a number in Spanish for anyone who is of Hispanic origin, and that is 1-888-628-9454. Veterans Crisis Line is available, and here in our community, Southwestern Behavioral Health has a crisis line and a suicide prevention line. Suicide prevention line is 812-422-1100, and the number for the local crisis line, which is, these are all 24/7. Someone would answer the phone any time of the day, 812-423-7791. So these are numbers that are at your disposal, at your access, if you're feeling that you're in crisis. But if you're not at the point of crisis, make sure that you reach out and talk to someone. If you feel like a friend is in crisis, then say something to them, have a conversation. And it's well recognized that depression and suicide are a problem. The local agencies here in this community are on it. The Mental Health Center and Southwestern Behavioral Health work to bring in celebrities and people who have great knowledge and experience of this to talk to the community. And in fact, Kevin Hines, who's a national speaker and will share his experience in November, will be here for an evening presentation, is also presenting in Jasper, Indiana. He, at 19 years old, not too many years ago, jumped off the San Francisco Bridge, which is the second leading site of suicide in the world, and he's coming to tell his story. So this is a conversation that's being held, but I just don't think we talk enough about it. And obviously, if there was a conversation that Robin Williams had several days ago, he might be sitting at the dinner table tonight with his wife. So please hear what I say, and if you need help, please reach out.